Okay, now I just want to paint you an extreme picture to give you an idea of how insulin resistance develops and onwards to diabetes as well. So picture a person eating nothing but pure sugar all day. Now, the blood sugar, every time you eat sugar, is going to come up quite high. Your body's going to release insulin, and that insulin response is going to stay equally high because it's trying to scoop all that sugar out of the bloodstream. Now, imagine the liver and the muscles are now fully stored up with sugar. They've taken all that they can handle. Their pantries are full. So it's up to the rest of the cells now to store the extra glucose. Now, this extra glucose in other cells, apart from the liver and the muscles, this glucose gets stored as fat because it's a much more efficient way. So the cells convert the excess sugar into fat molecules and then store them away. If you think of it like a cupboard, it's kind of like packing all of the sugar up into boxes so that you can stack them into the cupboard a lot easier. So that's what happens in the cells. However, when this continues, they just become too full of fat. They simply can't take any more. That cupboard is overflowing. So the cells start to say no to insulin. All right, so insulin keeps coming up, knocking on the door and saying, hey, I've got some glucose here for you. And the cells start not responding. So they start to actually lose their insulin receptors. So the little molecules and little receptors that stick out this end of a cell that insulin can attach onto, they actually start to withdraw those. They start to get rid of them. So insulin simply can't tap into that cell and can't let glucose in. It's kind of like boarding up your front door, right? So the salesman can't keep coming knocking. This is what we call insulin resistance. So essentially the cells become resistant to the insulin. So even though there's plenty of insulin there in the body floating around trying its absolute best to get this glucose inside the cells just turn off, they become completely resistant. Now, this isn't just a theory. It's a time and again science-proven fact, all right? If it continues for long enough, the insulin runs out of cells willing to take up the blood sugar. So all of the cells become deaf or ignorant to this insulin message. The blood sugar has nowhere to go in that case, and it just remains high in the blood. But the pancreas keeps getting triggers that this blood sugar is high. So the body keeps sending signals to the pancreas going, hey, you mustn't be doing your job properly. This blood sugar is still really high. The insulin goes, okay, I guess I just need to produce more insulin. I mustn't be producing enough insulin to get that sugar into the cells where it's needed. So the pancreas pumps out more and more insulin. That's all it knows how to do. It goes high blood sugar, pumping out insulin. That's all it has the ability to do. Now, what happens is a consistently high blood sugar and a consistently high insulin level will result in insulin resistance. Eventually, your pancreas, the cells simply can't produce any more insulin. They are exhausted. They have just been pumping insulin out like crazy and they can't do it anymore. And those cells actually start to malfunction. They start to collapse and they stop producing insulin. What happens then? The blood sugar rises even more because perhaps what insulin was being produced was working in some degree, but it's not anymore. So a diabetes diagnosis is this chronically high blood sugar and insulin that just isn't doing its job. Also, if you remember back to what's happened, all those cells have taken up an awful lot of glucose that they're all storing as fat. So this is why we tend to get obesity or weight gain in conjunction with diabetes, because the two really go hand in hand. Usually as the weight goes up, then the diabetes or insulin resistance tends to come in as a natural process as part of that. Now, it's not always the way. You do get people with type 2 diabetes that aren't overweight. However, it is a common presentation, and that's why the two scenarios, overweight and diabetes or insulin resistance, are so strongly linked.